What we found out was over a 20-year period that people with rheumatoid arthritis have a 1 in 4 chance of developing chronic kidney disease. That compares to about a 1 in 5 chance in the general population. That may not seem like a lot, but in fact, that's quite a big difference in patients who have rheumatoid arthritis compared to those who don't, and it has important implications for the course of the disease and for the management of the rheumatoid arthritis. Kidney disease in patients with rheumatoid arthritis can be detected very simply, and the techniques that are used for detecting kidney disease are the same as are used in the general population. And those are simple blood tests for something called a creatinine, which is a measure of kidney function, and as well an estimation of the glomerular filtration rate, which is the rate at which the kidneys are able to rid themselves of waste products. And those are very simple tests to do. A urine analysis can be helpful as well in defining the nature of kidney disease. That's also a very simple test to do. There's not specific guidelines actually on this issue. I think that this points out that this is a quite significant risk, and that patients who have chronic kidney disease down the road have more health problems. And so it's important actually to detect the presence of chronic kidney disease and the progression of kidney disease in patients with rheumatoid arthritis. And so I think that this should serve to help us be more alert to this possibility, and as guidelines for the management of rheumatoid arthritis are refined, this is a consideration that should be included. There are a number of things that patients can do to reduce the risk of developing kidney disease. I think first and foremost, important is control of blood pressure. So patients need to be very attentive to their blood pressure. I think also it's very important to maintain a diet that is not high in salt, which is a contributor to high blood pressure, which is a contributor also to kidney dysfunction. And avoiding medications, or at least reducing the use of medications that are directly toxic to the kidneys, is also real important, and that includes medications like the nonsteroidal anti-inflammatory drugs. We'd like to understand what the specific contributors are to kidney disease, and we'd like to consider what kind of interventions we might be able to do in order to reduce the risk of kidney disease in these patients.